very much.
Thank you.
Cantwell, you're next, and you're in charge, so when you finish, you can just you can adjourn the hearings.
Well, thank you, Mr. Chairman. I think I could go on forever, but because I think this is an important hearing, and I think, Mr. Chairman, you stated at the beginning with your opening comments that this is about legislation that is estimated to save 200, you said hundreds of billions of dollars in the reform of our Medicare system. Some people are saying, oh, let's do vouchers instead, or privatize it, or do something else. But the truth is that this legislation has very powerful tools for reducing the cost of Medicare moving forward. And if we get rid of them somehow, we are going to be in a world of hurt. So I just wanted to get your commitment on some of those provisions. One, the rebalancing of away from nursing home care to community-based care. Our state has saved about $243 million in about a 10-year time period by shifting away from nursing home care. And so I want to see, I think the estimates are it could save $10 billion federally over 5 years, how integral you think that shift is. Obviously, there is also a provision of this legislation that allows people in community-based care to hold on to their assets. So it really is going to have more people staying at home and having the benefit of getting home-based service. The value index, moving away from fee-for-service to a cost-efficiency model, we think that could save anywhere up to $100 billion for our healthcare system, of moving that 30% of waste, fraud, and abuse in the system to a model that's based on quality care. And so I'm curious as to how essential you think that is to the success of Medicare moving forward. The basic health plan, another tool to give states the ability to negotiate on rates for lower insurance rates for their consumers, and is CMS going to give technical assistance to states on how to implement that, and obviously not penalize states who've already gone down that road. The PBM transparency provision, we think, is probably another provision that could save as much as 10% on brand name drugs by giving the aggregate types of rebates and price concessions to CMS so that we really understand that. So all of those are tools that we put in this legislation. How critical do you think they are? How will you work to implement them? And how can we get your guarantee that these are the critical frameworks for cost controls?
I agree with you. These are all important levers for doing what I said in my opening statement we can do, making care better and more affordable at the same time. Take the rebalancing work and the work we're progressing now on home and community-based services. People don't want to be in institutions. They don't want to be in hospitals. So for a way to get them into communities with the proper supports, it's better for them, it's better for their families and loved ones, and it will, in general, lower costs substantially. It's a very important example of progressive work. And yes, there's new authority in this law and in older legislation to help states try out their forms of home and community-based services, and I'm totally in favor of that. Integrating care through accountable care organizations and medical homes will save money, and using the value index idea. The idea there is that we should pay for what we want. We want quality, we want better outcomes, we want satisfaction on the part of beneficiaries. Why would we pay for fragments, little piece by little piece, instead of understanding where value really lies? And in order to do that, we have to have tools like the value index.
And how big a component do you think that is for the success of Medicare and reducing Medicare costs moving forward? A small piece or a very large piece?
A large piece. Measuring what we want and attaching incentives and rewards for going there is logical and powerful.
Great. Well, we have a vote on. I'm sure we'll have a chance to talk to you again about these, but I think it's very important that we understand that the tools are here. They are already law, and we now have to get about implementing them. And the more people talk about delaying them, the more we're going to delay cost controls, and the public will greatly benefit by this. So I thank you. The hearing is adjourned.
Thank you, Senator Cantwell.